For the last 30 years, my colleagues and I have been sponsored by the National Institutes of Health and large private foundations in order to evaluate natural methods to lower blood pressure, reduce stress, and prevent heart disease. This work has been published in major medical journals in the United States and around the world. And today I'd like to share with you the results of our work in how to lower stress and how to lower blood pressure naturally. A very exciting event happened just in June of 2013 when the American Heart Association reviewed this research and all available research on alternative methods to lower blood pressure, on stress reduction methods, meditation and relaxation. And what they concluded is that the transcendental meditation technique is the only meditation practice that has been shown to lower blood pressure. That's a remarkable finding, and I'm going to review with you some of the research on which the American Heart Association based their findings. Another key point that the American Heart Association noted is that not only does this particular form of meditation, TM, lower blood pressure consistently, but it is the only meditation practice that has been shown to reduce death, heart attack, and stroke. This research was published by the American Heart Association's journal just about 1 year ago, and my colleagues and I were involved in that, and that's also part of this recommendation to consider this practice for your own health and well-being. But what is transcendental meditation anyway? This meditative practice is described as a simple, natural, and effortless technique to allow your active thinking mind to become more quiet, to become more settled, until a person experiences a silent inner state. This silent inner awareness has been called transcendental consciousness or pure consciousness. Scientists like to call it a least excited state of awareness, where a person is awake but not thinking. And there are dramatic physiological correlates of rest associated with this state of deep rest and alertness on the level of the mind, so it's been called a state of restful alertness. Physiologically, the brain shows high levels of alpha EEG activity and high levels of coherence or synchrony between different parts of the brain, which is unique with this form of mind-body practice. Physiologically, there are lower levels of stress hormones, lower levels of metabolic activity, lower activity of the sympathetic nervous system, which is the stress-related part of the nervous system, all indicating a state of deep rest on the level of body, along with this relaxed, wakeful state on the level of the mind. And many doctors and scientists think of this as a fourth major state of consciousness, this state of restful alertness, which is different from waking, dreaming, and sleeping, but which is very beneficial for health and well-being. This is a study that my colleagues and I did more than 25 years ago. It's a classic study where we recruited 102 subjects with high blood pressure, and we randomly assigned them to 3 groups. One group participated in a standard education control intervention where they learned about conventional methods to alter their diet and exercise more. The second group learned a conventional relaxation technique called progressive muscle relaxation. The third group learned transcendental meditation. And both of the active groups practiced at home for 20 minutes twice a day, sitting in any comfortable position, and easily integrated it into their normal daily routines. Here are the results. After 3 months, there was essentially no change in the education group. The relaxation group had a small reduction in their blood pressure. The transcendental meditation group, however, had a large change, a relatively large change, in their systolic blood pressure and in their diastolic blood pressure, which was twice as great as with the relaxation group. These results were published in the top journal in the field of high blood pressure called Hypertension, and showed in a strong scientific setting, probably for the first time, that an effective mind-body practice could lower blood pressure as much as some medications for high blood pressure, and that could start after 1 month and be consistent over several months' practice. Over the ensuing 20 or 25 years, there have been many studies on TM and other relaxation and stress management practices for their effects on blood pressure. And recently, all of these different studies on a variety of techniques were reviewed in a study of all the studies called a meta-analysis. And this was published in a top medical journal, and the results showed that when you look at the strong scientifically conducted studies, that muscle relaxation, stress management, many biofeedback techniques and combinations of treatments just don't have significant effects in reducing blood pressure. However, when you look at multiple studies and put them all together, transcendental meditation continued to be effective in lowering blood pressure where the others weren't. And this meta-analysis or study of all the studies was one of the key sources of information that the American Heart Association used when it conducted its review and published its findings on the distinctive effectiveness of TM. Now, stress and anxiety are very much related to high blood pressure and may contribute to heart disease and other conditions as well. A group based at Stanford University reviewed all the published scientific literature on anxiety. And this was another meta-analysis, a big study of all the other 146 studies on various meditative and relaxation practices. And what they found is that there was some effect in reducing anxiety with some relaxation techniques, some biofeedback techniques, various meditation practices. However, on average, most of these practices had results that were the same, or in some cases, less than placebo. Yet, when you look at the studies of transcendental meditation, the effect was about twice as great in reducing anxiety as for other relaxation techniques. Why could this be? Physicians and scientists believe that it's because that during this meditative practice, people experience this state of restful alertness, this state of inner silence associated with this brainwave coherence and this very restful state of physiology. It's that unique state, that fourth state of consciousness or fourth state of physiology, we can say, that seems to be responsible for these effects on anxiety and probably effects on blood pressure and other health outcomes. In the past year, a group in Europe did a revised or an up-to-date analysis of all the available literature on psychological stress and mental health with various meditation practices, looking at the strong scientific studies. And in this study, which came out again just in the past few months, transcendental meditation was significantly more effective in improving psychological health and reducing stress than studies of mindfulness meditation or other meditation practices. About 5 years ago, my colleagues and I conducted a study in another high-stress group. These were college students at American University in Washington, D.C. And we and our collaborators randomly assigned half the subjects to practice TM for a semester and half the subjects to continue their normal studies. And what we found using standardized psychological testing is that the students who were practicing TM for a semester had significantly lower levels of anxiety, significantly lower levels of depression, lower levels of anger and hostility, along with improvements in coping ability. That means they were able to cope with stress in their daily lives more effectively, and they show that in reduced levels of psychological stress, anxiety, depression, anger, and hostility. And furthermore, these changes in psychological stress were correlated with lower blood pressure in the subjects who were at high risk for high blood pressure. There are other risk factors for heart disease. One of them is called insulin resistance. This is a condition found in many people who are overweight, which is more than half of the American population, and also people who have high blood pressure. And this means that the handling of insulin and sugar is not ideal, and it's a condition that predisposes to diabetes and heart disease. Our colleagues at Cedars-Sinai Medical Center, along with our institute, with funding from the National Institutes of Health, conducted a clinical trial, a strong scientific study on the effects of TM in heart disease patients compared to conventional health education. We measured their insulin resistance before and after 4 months of practice and found that the transcendental meditation practicing group had significant reductions in their insulin resistance. And in this case, lower is better, because when you're not resisting your own insulin, that means you're processing your own glucose, your own body sugar, your own insulin better, and then you have less tendency for diabetes and heart disease. This was published in the American Medical Association's journal, The Archives of Internal Medicine. Now, the American Heart Association, again, just within the past few months, reviewed this literature on blood pressure. They also reviewed the literature on long-term effects of meditation, and they reported that lower blood pressure through transcendental meditation practice is also associated with substantially reduced rates of death, heart attack, and stroke. Let me show you where that came from. This was a study that took us 10 years to conduct and sponsored by the National Heart, Lung, and Blood Institute, which is part of the NIH. This was done in Milwaukee, based at the Medical College of Wisconsin. And in this study, our collaborative team recruited about 200 patients with heart disease, assigned half of them to a conventional education program, half to practice TM for 20 minutes twice a day, all continued their usual medications and saw their doctors as normally. And then we followed them for more than 5 years on average, although it took us more than that to do the whole study, but each subject was followed individually for more than 5 years. And the results showed that there was a 48% reduction in the rate of death, heart attack, and stroke in the transcendental meditation group. This is really remarkable because this effect was as strong or greater than studies of conventional medications to treat heart disease and prevent heart attack and stroke. However, these patients were already taking usual medicines and taking their standard medical care. So it's like the discovery of a new class of therapy, a new class of medications, but in this case, using the body's own internal pharmacy based on this experience of restful alertness for 15 or 20 minutes twice a day. Not only are rates of heart disease reduced in studies of transcendental meditation, other studies of several thousand TM practitioners have found lower rates of hospitalization for other serious conditions also. This study shows 40 to 50% reductions in hospitalization rates over several years' time in a group of 3,000 TM practitioners compared to several hundred thousand controls. Recently, the Wall Street Journal reviewed all this information on meditation and health, and what they concluded is that it should be doctor's orders, 20 minutes twice a day of meditation to prevent heart disease, lower blood pressure, lower stress, and improve your health. And I agree with the Wall Street Journal that anyone with high blood pressure, with stress and anxiety, or any risk factor for heart disease should consider this practice of TM for their own health and well-being. Questions from the audience. First question, will my blood pressure drop immediately after learning TM, or will I have to wait? Based on my clinical experience and that of other doctors and practitioners, I would say that many people who learn TM report that they experience immediate benefits in their psychological health and reduction in stress, reduced blood pressure, and improved well-being. Scientists have done studies looking at monthly measurements of blood pressure, and in those studies, blood pressure begins to go down measurably in groups on the average after even 1 month, and continue to 2 months, to 3 months, and even long term. So I would say that the benefits for many people can be immediate, and then over time, they can be even cumulative. Second question, may I discontinue my medications after learning TM? Again, continue to work with your doctor or healthcare professional, and as your blood pressure drops with TM practice, then you can coordinate with your doctor or healthcare practitioner to adjust your medications properly. Next question. I've been hearing about mindfulness meditation. How are the effects of TM different from it? Based on the research that I've seen, there are some effects of mindfulness meditation, particularly in the mental health or psychological health arena. However, when you look at the physical health arena, the American Heart Association has pointed out in particular that transcendental meditation is the only meditation technique that's shown to reduce blood pressure, and they particularly commented about other meditation techniques, including mindfulness, and said that either the data shows no change in blood pressure or there's just not enough information to tell. So if you want to go with the scientific evidence in the blood pressure area, in the heart disease area, then TM appears to be the most effective technique, and that's what the AHA is saying in the BP area. In terms of psychological health, there is recent meta-analysis data, that means a study of all the studies, which is just published recently, which shows that while mindfulness does have studies showing improvements in psychological health, the effects of TM practice are significantly greater in improving psychological well-being and reducing mental stress. Next question. I've tried other meditations and they're not very easy. Can I do TM? Over the past couple of decades, in many studies, we've worked with people of lower socioeconomic status, people who are low income, people who are low education, people who are high income, and people high education. We worked with younger people, we worked with older people. And what we found in our studies and projects is that anyone can practice transcendental meditation. It seems to tap into an inherent ability in the human nervous system, in everyone's physiology, to experience this state of restful alertness, to settle down and relax, and yet stay awake. So I would say, based on my experience, anyone can do it, and I haven't heard of anyone who can't. Next question, can children and teens with stress and anxiety practice TM? There have been studies on school children done at the Medical College of Georgia and in other places showing that transcendental meditation can be incorporated into a school routine. In these projects, children come in and their first class of the day, their homeroom class, is meditation with TM for 10 minutes, and then the last class of the day is TM. Studies have been done in schools where there are many ADHD children or children suffering from that disorder. And in those schools, children learn very well this practice, and they even have reductions in their ADHD symptoms and other symptoms of stress and anxiety. So yes, children and teens can learn the practice according to the published studies and do show benefits, both in terms of lower blood pressure, lower heart disease risk, and reduced stress. And remember that heart disease begins in childhood. We have such an an increase in rates of overweight and rates of high blood pressure even in children now, and rates of stress. And that has effects not only on the children's quality of life at the time, but that will have great effects on their health over the next 10, 20, or 30 years. So yes, they can, and yes, the data suggests that they would have a lot of benefit, both short-term and long-term, from practicing this technique.